In a recent Kaiser Family Foundation poll, one of four surveyed said they are a family member. I'll get it straight in their household had problems paying their health care benefit between 2024 of July and July 2025. And roughly one in five adults said they had not filled a prescription because of the cost. It's getting up there. Today I've got Joshua Fredell, pharmacist and senior vice president at CVS Caremark. And he's got patients. He says patients may be more powerful than they realize when it comes to prescription drug spending and take more control of their health. He joins us to explain because I'm one of those people going, really? Joshua, how are you this morning?
I'm doing good. Thanks for having me.
Thank you for joining us. Now, Joshua, the skyrocketing cost of prescription medication is a growing crisis for many Americans, especially now. How can people cope with this trouble trending without compromising? Again, I can't talk. Their health. I need my drugs, Joshua.
Yeah, it's a great question. Drug pricing starts with where the drugs price is actually set by the drug maker, and there's a lot of work that's being done to lower the price of those medications. But for a patient, I think the most powerful step they can take is understanding their prescription drug benefit. And what I mean by that is really starting to understand what are all the medications that are available through my plan. What copay tier might they be on? Because what some people don't realize is most conditions have many medication options, and many of those are generics, which can be very low cost or other preferred brands. So starting there allows patients to have that information to then go have really great conversations with their doctor about other choices, which could very much lower their costs.
Now, Josh, what are the key steps to make the most of our benefits?
Yeah, understanding those options. If I'm talking to someone who might have high blood pressure, I'd want them to understand the several medications that are available today that are either generic or preferred brands that would be lower cost to them, knowing their prescription drug benefit. Then they can take that step with their doctor to have that conversation. Simply, could one of these be right for me? Because I know it could help save me money. It's a great next step they can take. But outside of the medicines, they should also look at their benefit to say, are there other ways that I can save? Some people can save on a copay by using like mail order pharmacy or getting a 90-day supply. Not only does that help them save money, it could also be more convenient to have the medication delivered to their door. So two just very practical steps patients can take to help take control of their healthcare and really take control of the costs they have tied to that healthcare.
Why is it important to take care of your health and avoid shortcuts? And what are some tips to achieve this?
Yeah, as I was mentioning with high blood pressure before, when we're prescribed medication for that, it's really to not only lower our blood pressure right now, which they can do a great job of, but it's to help prevent future complications that can arise. And if we do that well, not only will we be healthier in the future, but if we're healthier, we'll actually have lower costs for ourselves as individuals, but also for the healthcare system. So staying adherent, not skipping steps today is really important for being healthier tomorrow. How to do that? Besides having those conversations with your doctor about lower cost options, use the tools around you. Those tools might be provided by your health insurer, by your pharmacy benefit manager, or your pharmacy directly. A digital app tool simply to help you remember to take your medication every day. Very simple step to take, but can help a lot of us just stay on track with our medicine. Also use those tools to remind yourself when it's time to refill, because if we're late refilling just by a few days, that also means we're missing a few days of our medicine. So two very simple but very important steps to take to keep us on track with our medicine.
It sounds like very important. Now, do you have suggestions for how people can connect with experts, tap into available resources, and build a supportive community?
Yeah, that community starts not only with ourselves, but the people in our healthcare community already, like our local pharmacist and like our doctor. So do have those conversations, ask those questions about cost or other steps you could be taking. From there, use the online resources you may already have available to you from your health insurer or from your pharmacy benefit manager or through your pharmacy. They can connect you to great online and community groups around your healthcare condition or your medicines. And then learning from others, like the tips and tricks that they're using to help them stay healthy and help to have affordability can really help us as individuals as well. So tap into that community that's around you.
Now, where can our viewers go to learn more?
You can go to cvshealth.com to learn more, but also the websites, again, of your pharmacy, health insurer, or pharmacy benefit manager.
I was speaking with Josh Fredell. He is Senior Vice President and Head of PBM and Special Product Innovation at CVS, and also a graduate of Pittsburgh University. I know he's watching his football team all season long. Josh,
All right.
thanks for joining
Thank
us
you.
on Morning Blend. So how do you think your team's going to do this year?
I think it's going to be a tough season. I do.
I hear you.
Yep.
Thanks again, Josh.
Thank you.